All right, so welcome everybody to our Menopause Awareness Evening. Thank you for joining us. Just wanted to introduce our team to you so you can hear who you can see who will be speaking from this evening. Um, so, so my name is Fatima Hafizji. I'll be your host for the evening. I'm the Health and Wellbeing Team Leader at Brookside Group Surgery Group Practice. We'll also be having our practice nurse, Rosie, who will also be doing a presentation about all things menopause. We'll also be hearing from Bianca Lyon from the Move Through Menopause program, which is through Places Leisure. And we also have an attendee from the Move Through Menopause program who will also be sharing her experience after having done the course with the Places Leisure team. And we also have our Health and Wellbeing Advisor, Louise Simpkins, who will also be talking about our Health and Wellbeing service and mentioning some of the resources that also will be made available to you in the PowerPoint presentation too. Okay, so today's session, so we're aiming for it to last about 45 minutes or so, which will include the question and answer as well. So as you will have noticed, your mics and videos will be turned off. The reason for that is so that we have a smooth session and also to maintain confidentiality. So with that being said, you will be able to use the chat box. So for those of you who may not know how to navigate Teams or haven't used Teams before, there is a speech bubble which you can click at the top of your screen or at the bottom of the screen, depending on which device you're using. And there will be a chat box that appears on the right-hand side. And towards the end of the session, after the presentations, we can go through the questions and ask them to our speakers as well. Also, just so that you're aware, the session will be recorded today. This is just so that we can share this with other people who weren't able to make it today. And it's also just to spread some awareness for our patients at Brookside Group Practice. Also, there will be a survey that we will be doing right now at the beginning and also to be done at the end. It's using a program called Menti. So all you need is one form of device to access this. But if you don't have access to a device, that's absolutely fine. You can use the chat box to put your answers through once those questions are posed up on the screen. That's just to add a little bit of an interactive element to the evening today. Presentation. So as today the event is recorded, we will aim to be putting the presentation up onto our surgery YouTube channel. So you will be able to access the presentation again. And we're aiming to do that by the end of this week. So just keep a lookout on our surgery YouTube channel. Okay, right. So I hope you're all doing well. And if we make a start with our survey, so if you all can please type in menti.com into your internet browser. So I'm just going to exit the screen just for a moment. Okay, and when you put menti.com into your internet browser, it will ask you for a code. And the code is here on this slide. So the code is 2583-3095. If you can put the space in, that would be great, just to make sure it goes through okay. And if you can answer this question, that would be great. And hopefully, with all being well, we should be able to see your responses live. So in a single word, how would you describe how you currently feel about the area of menopause and perimenopause? So if we could start putting some responses in, that would be great. Wonderful. Okay, so lots of common themes in there: confusing, brain fog, stressful, taboo, unsure, uncertain, yep, tired, tiring, bewildered, optimistic, all-encompassing. That's really great. Thank you. Okay, I'm pleased to hear that it worked well, so that's good. Okay, and then the next one is, how confident do you feel in knowing how to best navigate this period of life? So now this question should have automatically moved you on to the next screen on Menti. Thank you. Wonderful. At the moment, we've got somewhat confident in the lead. Okay, any others? We had 19 responses on the last one, so just give you all a couple more minutes. Okay, one person feeling confident, two not at all confident. Looks like mostly somewhat confident. Great. Thank you. Thanks everyone for doing that. Okay, so we'll be doing this survey again then at the end of the presentation just to see if these responses have changed in any way. Okay, so if we go back to our presentation. So I'm going to hand over to Rosie. Just bear with me 1 second whilst I get the correct slide up. So Rosie, are you there?
I'm here. Can you hear me?
Yes, we can hear you clear. Wonderful. Excellent. So I'm just going to go on to your first slide. Over to you.
Brilliant, thank you. Oh, hello everyone. It's really good that I see some of you are out there. I've seen your responses, which is really good. It's great that you've joined us, and if there's any men lurking in the background, that's brilliant if you're there, and do come and have a listen, because actually men, it's really important that you're aware of this really challenging time of a woman's life. And I love my crazy lady on the screen just there. I think she sums up this time of life quite well. I think, I don't know if you can identify with her. And the poor little owl there. I do think we've got a bit of the short straw being women, haven't we? But there we go. So, what is menopause? Actually, menopause, it's literally a year after your last period, and that's not really terribly helpful, because who knows when that year has passed. And actually, even when you reach menopause, that isn't the end of all the confusing symptoms that you might experience. But this time of perimenopause, which is basically the time leading up to menopause, that is a time which is a little bit like this roller coaster ride. It's time of huge chaos. And it's because our estrogen levels are beginning to decline as less activity occurs in our ovaries. But it's not a nice slow decline that just gradually happens. It's actually a bit of a battleground, and it's to do with the hormones from the brain, the FSH, or the follicle stimulating hormone, which is trying to get our ovaries to respond, and our ovaries don't respond. So you get more FSH being pushed out, and our ovaries still don't respond. And over that time, you get the chaotic symptoms. And then finally, the ovaries give up and they do what they're meant to do. And we have a normal period, and suddenly you feel better again. And then you might settle down, and then you hit a challenging time again. And those hormone levels are changing throughout the day and from day to day. And hence the symptoms that come and go with the mood, the bleeding patterns. So that is what is so challenging. And it's really hard to know what is going on. As our estrogen levels start declining, we start getting all these symptoms as the levels begin to drop. I don't know if we can have the slide of my ladies. There we go. You can see the stuff at different ages there, just giving a bit of an example of how the estrogen levels drop. And if you look at our lady in her 80s, she's not got back her estrogen, has she? And that is the challenge. Imagine this scenario. Typically, first signs might be small, barely noticeable changes in your periods. They might come a bit earlier, a bit later than you expect. They might be a bit lighter, they might be a bit heavier. And why has PMT suddenly become such an issue? It might settle down again, and then a few months later, you're realizing it's hard to concentrate at work. You feel a bit more irritable at home. You meet an old friend while you're out shopping, who you haven't seen for a while, and you're thinking, what's your name? I can't remember. You put it down to your lack of sleep. In fact, when was the last time you had a good night's sleep? When you didn't have to get up to pee. You're having a bit of problem with your temperature control. Your jumper's off, your jumper's on. The duvet's being thrown off at night. The next minute you're freezing cold and you're soaking wet. Something really doesn't feel right. Why is life such hard work? Where's my joy gone? Why is it that driving the car has suddenly become an issue? I can't reverse into that parking space that used to be fine. I used to be able to multitask. Why have I suddenly got another wee infection? When did sex suddenly become so painful? Suddenly there's that light bulb moment. Could this possibly be all to do with my hormones? And so often it's like that. It creeps up on us. We don't know where it begins. We don't know where the end's going to be. But it often occurs at a time in our lives when children are often hitting challenging teenage years and leaving home. Work life's often more stressful. Parents are getting older and our roles are being reversed as they need more support. And as women, we often put everyone else first. We're great multitaskers, but we suddenly notice those balls are beginning to fall around us. Do you recognise yourself in that person? There's up to about 50 symptoms of menopause, and we've got estrogen receptors all over our body, and that's why every part of our body, as you can see on this slide, can be affected. So this is quite interesting to look at, this slide. So in 1900, the average age of menopause was 51 and the average age of death was 59. So women lived for about 8 years post-menopause. But in 2019, the average age of menopause was still 51, but the average age of death is about 83 for women. So we could be living for 32 years post-menopause. That could be a third or half of our life. That's a long time, and that's why this is really important that we think about it and talk about it. Let me introduce you to Mrs. Flush. She's 50 years of age. She's normally fit and well. Her last period was 5 months ago. She's getting hot flushes and night sweats. So is she going through menopause? She is highly likely to be. Does she need a blood test to check whether she's going through it? Actually, no, we don't need to check her hormone levels. And the hormone levels, a bit like that roller coaster ride, are going to be fluctuating day by day. So if we were to take bloods on her, they might actually appear normal. But if they are showing that she's going through menopause, we already know from her symptoms and her age. If a woman is much younger, there might well be a place for testing hormones, and particularly if someone's much younger, because we really need to know if someone's going through an early menopause. There might be a place for other blood tests because the symptoms of menopause can be quite confusing, and sometimes we might need to test for anemia, for diabetes, for thyroid problems, but checking for hormones isn't necessarily what we need to do. There are different types of menopause. Spontaneous is obviously when we just start going into it because of our age. If somebody has their ovaries and uterus removed, they are immediately thrown into a surgical menopause. And there are some drugs that might also send women into menopause. So who goes through it? Well, basically 100% of women, if you're a woman, you will go through it, okay? That's half the population. And 80% will have symptoms and 25% will have really severe symptoms. And they might last for many years, even decades. And it's interesting thinking about that scenario, but 70% of women don't realise their symptoms are actually due to menopause. So the list of symptoms, this is just a sample of them, and I think you're probably very familiar with them. There are a few we don't often associate with menopause, things like tinnitus, that can suddenly come on. Migraines can often be worse during menopause. And I think this whole PMT becoming a little bit worse than the changes in periods, often the very, very early signs of things beginning to change. And symptoms will vary from woman to woman. And for every woman, the intensity and duration of symptoms will vary. It is that roller coaster ride. And interestingly, 20% of women don't get hot flushes or night sweats. So, I've had ladies say to me, I can't be going through menopause. I'm not all hot and sticky. But some women just don't have them. It's a time of juggling with symptoms. The time of juggling with symptoms might be brief, but it might go on for years. I've got, ladies that are still on their HRT and have been on them for many years. I've heard 80-year-olds say that they still get the odd hot flush. That's a bit depressing, isn't it? And the problem is, when we get past menopause, it doesn't always mean that the symptoms will disappear. They might get a lot less and they might improve, but we don't really get our estrogen back. The fat cells around our tummies try and produce estrogen, and it does a little bit of good, but not a lot of good. The problem is it just sort of makes our tummies bigger, and then we have more fat sitting around our internal organs, and then our pancreases struggle to work, and that's why a lot of women get diagnosed with diabetes in the menopausal years. And that is also why looking after our weight is really important to keep our tummies down. But we'll talk a little bit more about that later. This next slide I find really hard because the impact of menopausal symptoms can really impact our lives. It can. I've had ladies where it's wrecked marriages. It's made women step away from their jobs or reduce their hours. It's led to not wanting to go out and just feeling really rubbish. And the boundary with what is our hormones and is it depression becomes really challenging sometimes to work out what is going on. And so it's really important that this is another chart actually from the British Menopause Society, and Women's Health Concern is the general public bit that you can go in and have a look at, without having to pay. But and this chart is actually again talking about the impact of menopause on our lives. So how are we going to manage this really challenging time of our lives? We're going to have a look firstly at HRT, which is hormone replacement therapy. And this is where we replace the estrogen that we're lacking. There are lots of benefits of having HRT. It will replace the missing hormones. It will ease symptoms, and it does help protect our long-term health. So women, I don't know if you're aware, our risk of heart disease men have a higher risk of heart disease at a young age, but when we get to 65, we start overtaking the men, and that is probably due to the lack of estrogen. So looking after our heart health is really important. Alzheimer's we may get some protection from. Osteoporosis, really important to look after our bones. Type 2 diabetes, and colorectal cancer. These are some of the benefits that are known through having HRT. I want to just briefly, I don't know if you can see me on the screen, I'm holding up a sheet here, which is understanding the risks of breast cancer. What I've done is I've chopped this chart into little bits so we can just break it down and have a look at the different sections of it, because it brings up a lot of the things that are really relevant when we think about using HRT, because it's really important that we understand risks of breast cancer. I think in a lot of people's minds there's a little bit of fear about HRT, and it's really good to put it in perspective. So this chart is looking at incidence of breast cancer in women aged 50 to 59, and it's per 1,000 women over a 5-year period. So generally in the UK population, you might find 23 cases of breast cancer being diagnosed per 1,000 women aged 50 to 59 over a 5-year period. Okay, there's a lot of numbers here, you can get your head around them. If women were to take HRT, there could be an extra 4 cases per 1,000 women in that age group on top of the 23 cases. So for women, it's not a huge number, but it just shows that there are slight risks to taking HRT. But let's have a look at a few other things. If we could have the next slide. So if you're drinking 2 or more units of alcohol a day, there could be an extra 5 women being diagnosed with breast cancer. If you're a current smoker, an extra 3. If your BMI is greater than 30, there could be an additional 24 cases of breast cancer. So a high BMI is more likely to put you at risk of breast cancer than taking HRT. But have a look at this next slide, because I think this is really good to look at. If you're taking at least 2.5 hours of moderate exercise a week, there could be 7 fewer cases of breast cancer. So the message here is that it's really important that we look after our physical health, that we focus on our exercise, we focus on what we're eating, and we'll be talking more about that later. Exercise stimulates our bone ends, the walking and jogging that protects us from osteoporosis. So it's really important that we weigh up these small risks. But actually, do you know what? If you take HRT, if you feel better, you sleep better, your mood is better, you're going to be able to better think about your exercise and what you're eating. And so there's then the benefits to our hearts and our bones and our joints as well. So it is all about weighing up this risk of how we live our lives, but also, you know, will replacing our estrogen just give us a so much better quality of life. So going back to HRT, one of the first questions we need to ask is, do you have a uterus? And the reason for that is that the estrogen, the hormone we need to replace, is the hormone that when we have our normal menstrual cycle, one of its jobs is to build up the lining of the womb so it's ready to receive a fertilized egg. And if we give estrogen as HRT, it might start doing its job that it was originally intended to do, and start building up the lining of the womb. So we have to balance it with progesterone. So that is why, if you get a bit confused when you hear about HRT, if you have a uterus, it's the estrogen you need to replace the hormone you're depleted in, but it must be balanced with progesterone. If you've had your ovaries and your uterus removed, then it is just the estrogen that you need. Okay. So just a little look at estrogen. So this is the hormone that you really need. And the best ways of having it are transdermally, which means through the skin. So this means that it's a really safe way of having it because it's absorbed immediately into the bloodstream. There were tablets in the past. We don't often use them these days, but it's the estrogen being processed through the liver that changes it and can put you at increased risk of blood clots and breast cancer. So estrogen through the skin is the safest way of having it. And it's available in gels, sprays, and patches. So the progesterone, which we need to balance the estrogen, you can have as a capsule, which is really body identical, this Eutrogestin. It's very similar to what we naturally produce, and it's really safe to be taken by mouth. That there isn't a problem with the progesterone, unlike the estrogen. But it can also be combined in a patch or the Mirena coil. And the Mirenas are brilliant, which I'll mention in a moment. And then what we have to do is we have to combine the estrogen and the progesterone. There's lots of different ways of doing this. So you can have the patches that are combined. You can have the estrogen as the gel, as a patch or the spray, and combine it with the Mirena, or with the progesterone tablets, or there are tablets which are both estrogen and progesterone. Depending also on where you are through your journey of menopause, also depends on how we give these to you. I haven't got time to go into it all now, but it might be if you no longer have any bleeds, it would be in a continuous way, so the same doses of estrogen and progesterone all the time. If you are still having periods, then it's important that we mimic the menstrual cycle and you have it in a cyclical way. So you have estrogen all the time, but 2 weeks on, 2 weeks off of the progesterone. Unless, of course, you have the Marina coil. Big shout for the Marina coil. The Marina coils are brilliant, partly because if you have really heavy periods, they are brilliant for reducing bleeding. They're a brilliant contraception because HRT is not contraception. And that's really important to remember that. So if you need contraception, we also need to add that into how we're managing menopause. But the Marina is also licensed as the progesterone arm of HRT. So if you have a Marina, you can just add in the estrogen via a patch or a gel or a spray. So it makes it a little bit easier to manage. So HRT for many women is an absolute lifesaver. It is that miracle drug. And it's brilliant at getting rid of night sweats and hot flushes and improving many symptoms. But just to be really clear, it might not solve every problem. And it's really important that we have a realistic expectation of what it might achieve. You know, bottom line is getting rid of night sweats and hot flushes. And over time, we might see a more subtle change in other symptoms. But at the end of the day, it is giving you back that estrogen that you're depleted in. Let's have a little look at Mrs. Leakey. She's booked for a smear test and she's been putting it off and she's been dreading it. Any of you out there like that? Really important to have your smear test. She feels uncomfortable down there and she can't remember the last time she had sex, but when she did, it was really painful. She keeps getting urinary tract infections and she certainly won't be doing any more jogging or skipping. So how can we help her? Mrs. Leakey is likely to have something called vaginal atrophy. And vaginal atrophy is basically the withering and the wasting away. This is where the vaginal area becomes quite raw and the lack of estrogen makes everything very dry and uncomfortable. It does lead to reduced lubrication, like the list here: dryness, discomfort during intercourse, vaginal irritation and pain, often thrush-like symptoms. And about 7 out of 10 postmenopausal women will suffer from vaginal dryness. There's also prolapses, and basically a prolapse is a condition where the muscles and the connective tissue of the pelvic floor weaken because of having vaginal deliveries, and they can no longer support the pelvic organs. This is a really common scenario, my Mrs. Leakey here, and often women don't talk about it. It's been underreported and undertreated in the past. I like to think as a surgery, we're very good at dealing with it now. And HRT is brilliant for a lot of symptoms, but it might not deal with the vaginal atrophy. So you have to deal with that separately. And the answer is vaginal estrogen. And this can have a really good effect. If I see a lady who really can't tolerate a smear test because it's just too painful, if she starts using vaginal estrogen, which can be via using a pessary or a cream, when she comes back to me 4 to 8 weeks later, it is often a lot more comfortable. It's not the nicest of tests, but it's a really important one. And if any of you out there are not turning up for your smears because it really hurts, do speak to somebody and get some vaginal estrogen, because it will make life a lot easier. And this sex is really uncomfortable. You know, it's an important part of a relationship. Actually, do not try it. If you're beginning to suffer from a lot of urinary tract infections, again, replacing the estrogen can also get through to the bladder area and sort of settle down the lining of the bladder and the urethra, so that you might find that you're not getting UTIs so frequently. I've got a lot of 80-year-olds still using their vaginal estrogen to keep their UTIs at bay. Okay, it can be used on its own or in addition to HRT. It's really important to keep using it. When you start it, you normally use it every night for the first 2 to 4 weeks, and then settle into just using it twice a week. If you stop using it, over time the atrophy will reoccur. Okay, so you do need to keep using it. Ladies, don't ever forget your pelvic floor exercises. Really important to, you're sitting there pulling up hard now, are you? Really important to keep doing them. I know we're told after giving birth we should never stop, and we do forget, but don't ever forget. And just a note on if you are prescribed HRT, if you're under 60 or if you're not entitled to free prescriptions, sadly you will have to pay for it. But 2 years ago, the government did bring in an HRT prepayment card. So for £19.30, which is the cost of 2 prescriptions, it will cover you for a year. So do go online, get that before you go to the chemist to pick up any HRT you might have. I'm going to hand you over to Bianca to talk to the Move Through Menopause course. Do you know what? I really wish this course was happening 20 years ago. My life would have been much easier, and it's really exciting what they're doing at Loddon Valley. So over to you, Bianca.
Hi everyone, so I'm Bianca from Places Leisure, and I am really lucky to be involved in a Move Through Menopause course. So what we've been doing is putting together this course. I was presenting the first ever course and had a brilliant time. We're now actually moving on to our 4th. So we do have Loddon Valley, and we've also got one going at Woking Leisure Centre as well. If we can go to the next one. So the course is obviously to target ladies like myself and you. About 50% of the population, as we were chatting about earlier, is affected by menopause because half the population is female. It's a normal phase of life for all women and can be fabulous. So it really gives us an opportunity to tune into our body and embrace this new chapter in our lives. Obviously, I love that saying that we can thrive through it. It is a 12-week program, not to worry. It's all right. We've got a 12-week program. So every week is broken down where we do about 45 minutes of a specific subject. We go quite in depth into the subject. We also have a little bit of time to chat about it and just kind of share some experiences and things like that. So each week is a different topic. And all the ladies that attend, it'll be amazing how much information and support you actually get through everybody giving their point of view as well. So each week we do that. So that's a 45 minutes that we do in regards to, it can be HRT symptoms, alternative treatment, women's health, work and lifestyle, everything to do with menopause we discuss through those 12 weeks. What we do after that is we move on to the activity section. So each week we team up an exercise or a class with what we've discussed. So every week we try something different, and it's all different ranges of abilities, different ranges of impact. Don't panic if you're on the course and think, oh my gosh, I've never done legs, bums and tums in my whole life. It doesn't matter. These are here to let you give it a try and see what works for you. What we really want you to do is try and find something that works for you to help you alleviate those symptoms and get active during menopause, because it can be so, so important. So every week is something different and new to try out. So some of the feedback we had after our courses that we've run is there was about 32% increase in activity levels, which is an amazing result. 18% decrease in overall symptoms and 11% decrease in physical symptoms. So I think that is a really good thing. The thing I'm really, really proud of and happy about is the 36% decrease in psychological symptoms. It's so important. I know as a woman having gone through menopause, it really, really does affect your self-confidence and all your mental health. So this is a great course. So some of the feedback that I got off my course, which I'm truly grateful for, is one of the comments made was I created an environment where we can all speak comfortably, and she made the different exercises accessible to everyone. This is what I was saying, don't panic if it's something out of your comfort zone. I really enjoyed the course and meeting the same group of ladies every week. The other comment was I'd gained confidence to go back to the gym. Didn't realize my confidence was even an issue before. Now I'm a regular again. Highly recommended for peri and postmenopausal women and any woman looking back into exercise. So on the back of this feedback, I've got the lovely Joanne, who was actually on my first ever Move Through Menopause course. She was a participant, so she was part and parcel. So just going to hand over to her just for a few moments, just so that we can have a participant's point of view on the course.
Thanks, Bianca. Hello, everyone. Yeah, I did the course because I suppose I was looking for something different to do, and I'm reasonably well informed about menopause in some aspects, but not a lot of other things. So I didn't know about a lot of the medical things, and I also wanted to try some of the different sports activities, even though I go to the gym, because I know it's good to get out of my comfort zone. And what I really liked is that just having the women to chat to each week, because everybody's got such different things going on, and people would talk about, are they on HRT, are they not? So you just can't assume things, you just find out what's going on. There was a lot of support between the group as well. I'm sure some friendships have been made. And if you couldn't go to a session as well, it didn't matter, you didn't miss too much, you could just pop along the next week, if you've got commitments and things as well. That's what I really liked as well.
Awesome. Thank you so much. It was great having you as part of it. So we got to share your knowledge too. We can move on to the next bit. So the Move Through Menopause, the next course that's coming up at Loddon is on the 7th of November. So the 12 weeks will run, because obviously we've got the Christmas break till the 6th of February. Just that you are aware of the pricing. So we open it to non-members and members alike. And it is £90, but that does cover your 3 months. That does also allow you full access to the gym. So you can attend swimming, you can go to classes, you can go to the gym, over and above coming to the weekly sessions with us, going through the information section and week to week a new class. If you want to register your interest, obviously you can speak to your GP or you can pop onto our website and you can register, and we will then get in contact with you to get you enrolled on the course. We also run menopause cafes. So if you're not quite ready to take that step into committing to a 12-week program, we are running menopause cafes where you can literally just pop in, come and see us, have a chat, and just kind of get a feel for, what to expect, or ask some questions about the course that you might not feel comfortable kind of just enrolling. You might need a bit of encouragement or a little bit better understanding of what to expect. Friday the 18th of October this week, we've got a cafe at Loddon, and we're also going to have a presentation from a healthcare practitioner, which will be really great in regards to HRT. One of the other things we do cover in our course, we do go through nutrition, and obviously in regards to eating a healthy, balanced diet. As Rosie was saying earlier, one of the great things about menopause is the menobelly that we get. So along with exercise, our nutrition becomes more and more important. Now, I'm not a nutritionalist, so I can only go into kind of basic details on this, which we do in the course, but does give you avenues on how to seek extra information and just some guidelines on what to do to help us on our road to making the most of that period during our peri and post menopause. So obviously we cover things like Mediterranean diets, what the benefits are, and also supplements, things like vitamin D and calcium. And one of the really interesting points about that Joanne actually brought to the table was be careful on just taking supplements willy-nilly. Make sure that you're doing the right thing for you and you've got them in the right amounts. Obviously, nutrition, fruit and veg. Very few of us actually get enough fruit and veg in. So try and get into habits of at least 5 portions a day where you can. And as they say, eat the rainbow. Lots of different colors, lots of different flavors. Obviously, fats are part of nutrition as well. Don't be afraid of them. There are healthy fats out there. So a lot of people say, I'm just going to cut fats out and hope for the best. We'll go through on the course what's good and bad fats and how and when to use them. Some of the other things that you can do to help yourselves is obviously stop smoking. Main thing, really, really good plan. Exercise regularly, eating a healthy diet, maintaining a healthy weight, and medications such as statins. These all help as well to maintain a healthy balance and hopefully reduce those symptoms.
Hi, so my name's Louise. Thanks, Bianca. That was brilliant, and the course is so exciting and so good to see. I'm part of the health and wellbeing team at Brookside Group Practices, and the health and wellbeing team, we work alongside the medical clinicians because we recognise there's a whole host of things that affect how we feel, both physically and emotionally, and they're not always best served by a medical solution alone. So the way we get to work is we get to have slightly longer appointments where we can hear from you what's going on, what's important to you, and then we can look together for resources, for specialist services, support for groups, or look at goals. So looking at those small changes together that can make a big difference to how we're feeling. We get to have a few ongoing appointments with you as well, and all those things. But if you are interested, you can self-refer to us. You can do that either through the link that's at the bottom of this slide or that fabulous QR code. So if you want to get your cameras out and take a picture of this screen, feel free. You can also speak with a clinician about seeing us. And obviously, all these slides will be available on the recording of the webinar. So if you don't get to take a picture of it now, please just have a little watch again and check out what we're looking at. Above the links are some other resources which we thought you might find quite useful. Just more information, more people talking about their experiences, and how they have got to thrive in this phase of life. And we'll just finish with a final quote on the next slide, which is from Davina McCall's book, and it says, "Ladies, we need to go out there and live our best lives so the next generation don't fear menopause like we did or still do. We need to show them that far from drying up and disappearing, we blossom and we flourish." I'm going to hand back now to Fatima.
Thank you. Wow, that was amazing, everybody. Thank you so much, Rosie, Bianca, Joanne, Louise. That was absolutely incredible. I'm definitely feeling inspired, and I hope everyone listening in is as well. So if we just go back to our good friend Menti, and we just have a look at the last couple of questions. So if we move on to, so just a reminder on how to do that for those of you that that missed this in the beginning. If you just type into your internet browser menti.com and you type in the code 2583 space 3095. This question should pop up on your screen. Thank you. I've already got responses coming through. And these are looking very different to the ones that we had in the beginning. So this is really great. Informed. Okay, some still feeling the same. Relaxed, educated, inspired. I like that word, relax. Yeah, empowered. That's a great word too. Wonderful. Hope. That's a really good word too. Well done. Bit unsure. Okay, yep. It's a new stage of life. So yeah. Okay, that's really great. Thank you. And the last one from Menti. So again, so the same question after today's webinar, how confident do you now feel in knowing how to best navigate this period of life? Wow, okay, great. Yeah. I'm very pleased that this is working, so really great. Thank you, everybody, for contributing to this. Great. Okay, so somewhat confident, and very confident. Any more? Okay, that's fine. So we'll say the most responses was with somewhat confident, but we do have some very confident ones and also somebody else feeling confident as well. So that's really good. Okay, so yeah, it's definitely something, it's about learning, right? And each person's experience being different, but knowing that there's so many resources out there to help. Okay, so if we go back to the presentation, just bear with me a second. Okay, I'm just going to go over to the chat box as promised, just to see if there's any questions in there. Okay, so I can't see any. Louise, would you be able to just double check for me? And nothing's through on your end? I have one that just
No,
says
no through
informed.
here.
Yeah, okay, all right, just wanted to check. I was seeing the same thing. Okay, so we do have one, we'll take 1 or 2 questions, just to double check nobody has any. You can pop them in the chat box. Okay, so there's one that's come through. So if on progesterone pill for contraception, can you start estrogen treatment? So Rosie, that looks like that one's for you.
So if you're taking the progesterone-only pill, that isn't licensed as part of HRT. So if you're on the progesterone-only pill and you want to start HRT, then you've got some different choices. You can continue with your progesterone-only pill and start HRT, but you will still need the estrogen and the progesterone to balance the estrogen part of HRT, because the progesterone-only pill isn't licensed for use as part of HRT. It's all to do with protecting the lining of the womb or the uterus, and that is why the Mirena coil is so good. So so you are absolutely fine being on progesterone pill and HRT. You also have a choice to swap to having a Mirena coil, and then you've got your contraception dealt with, your menopause, and you can just add in your HRT, your estrogen part of HRT.
Great, Rosie,
Okay.
since we've got you, there's one more on there about that's clinical. How is the spray administered and is it commonly used?
The Lissetto, I've see very few ladies with it. A few have used it when we've had supply issues, but some women love it. I think it's just not sort of top of our list here. But if people want it, they're very welcome to try it. Yeah.
Okay, and there's a question on here about who the best person to see at the practice is. So what I would suggest is you just complete an anima or contact the surgery as you normally do, and then the team here will put you in touch with the right practitioner to help with that. Okay, so you just complete the anima form as you would normally. So I hope that's helpful. Okay, so I'm just checking the next 2 questions that have come through. Okay, there's one on there about estrogen, but had a PE. I'm on blood thinners and have had a full hysterectomy. I'm 59. I'm not sure what the question is on that one. We can skip down to the next one, but if you could just clarify the question on that one, that would be good. And then how long can you be on HRT for, and when do people stop using it? Rosie again.
In theory, you can be on it to the grave. Okay, having the estrogen through the skin is so much safer. The advice is obviously you want to be on the lowest dose to control symptoms, and you can have a go at reducing the dose or stopping it and see if you get symptoms back again. If you do, you probably need to continue with it. But it is it is that whole thing of balancing your risks with the advantages of being on it. But if you start stopping it and you're back to that the night sweats, hot flushes, then do continue with them. We always do a review every year to discuss if it's still the right thing to be on. But certainly in theory, I'm not going to be racing to take anyone off it if you're still benefiting from it. And it won't necessarily delay the stopping of the symptoms. If your body's sort of naturally gone through it all and you aren't getting so many symptoms, then you'll know when you stop. If you're getting the symptoms all back again, just keep going. And people do various things. They start reducing the doses or maybe chop their patches in half. Some just stop and see what happens.
Great, thanks, Rosie. There's another 2 questions have come through. I think that might be something to put onto an anima form, and it might be best to maybe have a chat with one of the clinicians here to discuss that further. So I hope that's okay for the next 2 questions that have come through on the chat box about HRT, if somebody can have it, and also the other option other than the Mirena coil due to the current history. So I hope that's helpful. But do complete an anima, and then the team can get in touch and get you seen. Okay, so that's great. Wonderful. Okay, so it was lovely having you all. I think we are finishing the session now. So thank you so much for taking the time out to join us this evening. I hope you're all inspired, as I definitely am. Lots of takeaway tips and points that I've taken away today myself, and I'm sure I've seen lots of hearts and claps and things, so thank you. Speakers, you are all fabulous. And yeah, it's lovely having you all on the call today. Thank you so much for your support. And again, thank you to you all who attended today. And just a reminder that the webinar is recorded, so we will be putting it up onto our surgery YouTube channel. We're aiming to have it up by the end of this week. And just a reminder that if you wanted to do the Move Through Menopause program, Bianca kindly shared those details. You can find the details on the Places Leisure page, and you can actually enroll onto their program that way too. So I hope many of you do, but enjoy. Have a lovely evening, everyone. Take care. Bye-bye.